I had a series of symptoms for months. Pains, nerve pains, muscle pains, some dizzy spells, some things like that, which I always put towards something else. One night I was laying in bed and I was having a constant pain down my right leg into my toes. And I called my husband over and I said, "What do you think? Doesn't that look a little strange compared to the left foot?" And he goes, "Yeah, your toes seem a little out of whack." We decided to just go to my physician and say, I've been having this ache, and she recommended an MRI. We went to the MRI. After maybe 20, 25 minutes, the technician came in and said, "You can't leave." And so I went back to my physician. She had the report. She finally brought us into one of the examining rooms, and she says, "Look, I have a report. You have a mass." And we were stunned. We were shocked. So she gave me a local surgeon who we had a consult with. And he reviewed the MRIs and he said, I can take care of this. He thought a little longer and he goes, "Let me give you a couple of names that really know about this condition." So he wrote 2 names down. And I said, "Okay." And he says, he points at one in particular and says, "This guy, though, he wrote the book on this kind of thing." And that was Dr. McCormick's name. I was actually born with an epidural tumor and had that removed when I was 8 months old. So as far as we knew, it was a situation that was taken care of. But Dr. McCormick informed me, he said, at that time, they did all they can do. And they did do a good job for what it was. But the form of the tumor, being that it has a tail that may actually lead into your spinal column that they maybe couldn't have gotten to or couldn't have seen with that type of surgery, it can regenerate and come back. So with that information, it really said a lot to me. He understood the condition and he knew he could manage it, he can handle the surgery. I think we felt immediately when we met Dr. McCormick that he was very confident and comforting and informative and very capable. Our last visit before the surgery, and he went over some final things, and he ended it with, "Joanna, this is going to be in your rearview mirror. It's going to be behind you." It is. Columbia Presbyterian was just great to us, to me, and my husband as well. We just feel they were wonderful from day one. Scheduling McCormick's appointment to meet with him, their response when we called the office, down to when we scheduled the surgery, the day I got admitted. From the beginning, when we walked in, the admission, everything felt so smooth.
Well, we were blessed to have the right people at the right time. And then, of course, when we met Dr. McCormick, you really felt the sense that, when Dr. McCormick said, "Hey, this is going to be about a 7-hour surgery," he was like, by the minute. It was incredible, So
Yeah.
all of that, all the aspects were covered. And that's, it's hard to believe, but that's the truth.
I feel good now. I am most proud that after recovery and a year almost to date of the surgery, we tried for a baby, and he is now 1. So that is the best thing that ever happened. Don't eat the can. You eat the can, you eat this. Okay, very good. There's nothing that's going to top that now. This is a fairy tale. You love him, you love him. I do look at my life differently now because now I know anything can happen. Things happen when you least expect it. But there's always a positive that comes out of it.